welcome back, ladies and gentlemen. As promised, we are headed to our second lounge of the day, and we are having a discussion on all matters TB awareness. And I asked, when was the last time you had a conversation around TB or tuberculosis? When was the last time you actually had this conversation? So I believe it is very important. I am not alone. I am joined by a beautiful, brilliant lady that is going to be helping me delve deep into this conversation. Good morning.
Good morning.
How are you doing?
Fine, thank you.
I want you to say hello to our audience. Tuambie wewe ni nani, what do you do? Then we delve right into the conversation.
Wow. Good morning. I am Makena Penina. I work for Nairobi County Government. I coordinate TB, leprosy, and lung diseases in Roysambu Sub-County. Yes. And I'm a clinician as well.
Amazing. Thank you. Yes. Thank you for joining us today. Karibu sana to KUTV. We want to have a conversation on matters TB. Let's start from the very, very beginning. What is TB? Tuanzie hapo from the basic definitions. What is TB?
Well, so TB is a chronic infectious disease, actually airborne, that is usually caused by a bacteria. I know it's not very important, but yes, it's known as Mycobacterium tuberculosis. And it spreads from one infected person to another person. Yes. Since it is airborne. And anybody can get TB, and TB usually affects all body parts except the hair, the nails, and the teeth.
So everywhere else?
Everywhere. Every part of the body can be affected by TB, except the hair, nails, and teeth.
Wow, okay. Yes. Then this is important. This is a very important conversation to have. So why is TB awareness important? To layman, common mwananchi, why are we doing a TB awareness, and why is it important to keep the awareness of TB, constant?
Yes.
Yes.
It is key to make our population aware of what's happening around TB, because like we said, TB is an airborne disease, and it is important for us to be screened of TB as early as possible. Yes. Because if you come to our facilities when it is very late, or when TB is quite late in your body, the probability of even dying is quite high. Yes. Another thing, your curing process is quite slow, so it is key for us to screen you as early as possible, so that we make a diagnosis as early as possible, and also treat you as early as possible.
Okay. Yes. So earlier diagnosis, the earlier the diagnosis, the better. The better, and even the chances of healing are better. So I hope that we are keeping up with this conversation and learning a thing or two. So how can one get TB? I feel tunaingia class, as we talk about awareness, tunaingia class kidogo. Yes. How can one be able to contact TB?
Like I said again, TB is an airborne disease. Yes. And anybody can get TB. TB is not for this person or the other person. It is for everybody. Anybody can get TB, because it is an airborne disease. So, but there is that category that has a higher risk of getting tuberculosis, and these categories includes people living with HIV, people with malnutrition, people who have diabetes mellitus, people who are suffering chronic diseases like cancers, very young populations, and very old populations. Yes. These people have a lowered immunity, and since TB is an opportunistic disease, these categories can be infected with tuberculosis. Yes.
Amazing. So all these people can be able to contact TB. Anyone can, but people with a lower immunity, very young, very old, are at a greater risk. Yes. So this means if you're a parent with young children, you should be in this conversation. Yes. If you're an elder in the community, you are. This conversation is very important. Yes. If you are infected with HIV and AIDS, this conversation is yours. That is why I think all this is saying why having the conversation on TB awareness is very, very important for everyone that may be watching. Let's get down to signs and symptoms. How do I know I have TB or suspect that I have been infected with tuberculosis?
Wow. Some signs and symptoms of tuberculosis. For adult population, when you present with a cough of any duration, we no longer talk about cough of 2 weeks. Yes. We talk about cough of any duration, because if the cough you had today is a cough which is as a result of tuberculosis, it will not change after 2 weeks or after a month or after a year. Yes. So it is cough of any duration, night sweat. This is an abnormal sweat at night. You sweat until you can even wake up at night to change the beddings. And then there is noticeable unintended weight loss. So this is not the weight loss that you plan to have.
Yes,
it is noticeable. Yes, unintended weight loss. And then there is fevers, and these fevers are intermittent fevers. They are on and off. Today they are there, tomorrow they are not there. In the morning you have the fevers, in the afternoon you don't have the fever. So it is usually low grade fevers. They are not very high fevers. Yes. For children, of course, there is reduced playfulness. They don't play like they usually do. And then they lose interest with the environment. They lose appetite, and of course they have respiratory symptoms or breathing system symptoms, where they also probably they are not able to breathe. They are also having some cough, and so on and so on.
Yes. So these are some of the symptoms you can be able to look out for in case you are suspecting that you have been infected with tuberculosis. Some of these signs you look out for, and like Penina has said, the key is to catch it early. That if it is tuberculosis, you're able to catch it early so that you can be treated and move on to actual healing. How can one be diagnosed with TB?
What we usually do in our healthcare facilities, we first of all do what we call history taking. So when you come to the facility, I think we usually hear a lot of people say maswali ya clinic. We ask a lot of questions. We want to know what has happened prior. Like we can even want to know how big is your house? Do you have windows? Do you open those windows? So it is key for us to ask you those questions. It's part of the history taking. So we want to know if you have the cough, if you have the fevers, you have the weight loss, you have the night sweats, and also for the children, if they are not playing, they are not feeding well, have they been adding weight? Are they reducing their weight? And so on and so on. We also do some examination where we usually like screen the chest ourselves. And then after that, we collect samples for examination in the laboratory. We can also do imaging, the chest X-ray, CT scan, MRIs in some settings if they are available. And then, we make a diagnosis, and after that we treat.
We move to treatment. How long does it take to treat TB?
TB treatment actually takes we have drug-sensitive TB, and we have drug-resistant TB. For drug-sensitive TB, this is the normal TB that like everybody knows, and it's the commonest actually. We treat it for actually between 6 and 12 months. For TB of the bone and TB of the joints and brain, we treat up to 1 year, that is 12 months. The other body parts, we treat for 6 months.
For 6 months.
For drug-resistant TB, we treat between 18 and 24 months.
So it is becoming increasingly clear why it is important to catch it early, because that period is quite a period of time, 6 months into 1 year, 18 months, and even 2 years.
For sure.
So you can be able to go for screening for TB if you have these symptoms. Kindly get yourself into a facility, and we're going to be talking about that, about which facilities you can be able to go and get diagnosis and treatment. But let's move to prevention, because we have moved to cure, but how can we be able to prevent ourselves from contracting TB?
Thank you. So prevention for TB is key. Actually, if our preventive measures were good, we would not have to be.
We would not need the treatment in the first place.
So, number one preventive measure is avoiding overcrowded places and opening the windows and the doors, and making sure that every ventilation, the natural aeration is the best. So when you're in an overcrowded place, make sure you open those windows, you open those doors, so that if there's somebody in that room who has TB, the people around will not be infected with the bacteria.
Okay.
The other measure is there is this TB preventive therapy. There's a therapy that usually, there's a medicine that we giving in our facilities, and this is a treatment course that goes for 3 to 6 months, given to close contacts and household members of people who have tuberculosis, especially the tuberculosis that was diagnosed via the sputum sample.
Yes.
So we usually give TB preventive therapy to these populations so that we prevent them from getting tuberculosis.
Exactly.
Yes.
So there are a number of ways where you can be able to prevent yourself from getting TB.
Yes.
What is the current TB situation in the country? Like, you can remember we're talking about the year 2020, then we moved to 2021. Did COVID affect TB awareness and all your data that you were collecting previously?
Yes. COVID really affected our TB case finding. Like, remember that time what happened? People were not coming to the healthcare facilities as much.
Yes.
The healthcare workers also were not so much enlightened on what is happening around COVID.
Yes.
It was a learning season for everybody. So people were not coming to the healthcare facilities. The cases really went low because all the efforts were directed to COVID diagnosis. So TB being a respiratory disease, suffered a lot under COVID. So the case finding for TB that time really reduced. Like in Nairobi County, we were only able to diagnose 9,000 cases. Against the normal that we usually do of around 12 to 13,000 cases per year.
Yes.
But along the way, we are catching up. The cases are really coming up.
Yes.
Remember, we want to end TB by the year 2035, the NTB strategy. So we are really catching up. We want to go back to where we were, and that is why we are doing a lot of screening for our populations. And this is what we are doing even during this World TB Day.
Yes.
So in 2022, nationally, we were able to diagnose 90,000.
Yes.
Around 90,841 cases. That was a 16% increment comparing with 2021. That is nationally. Yes, for Nairobi County, we are giving the 2022 data. We are giving national contribution of up to 13% case finding
of tuberculosis. And these statistics, they may just sound like numbers, but we say these are diseases. These are not just numbers. You know, I was talking to Penina before we came on to the show, and for some reason I expected Nairobi probably to have the lowest contribution. Turns out we are contributing to a pretty big percentage of the tuberculosis percentage of people that are actually getting sick. Why is Nairobi contributing to such a big percentage?
Well, Nairobi, we are giving such a high percentage because of numerous factors. Yes, like, you know, it's a cosmopolitan city, and everybody is here. There's a lot of overcrowding, everywhere. We have industries in Nairobi, the matatu industry. People are in those, like now we are entering another season, a cold season. And when you get to those matatus, the transport industry, all the windows are locked. Like nobody wants to open those windows. And that is why we advocate for, when you get to that matter, to make sure the windows are open, because you don't know how is your neighbor. He could be having tuberculosis. So overcrowding in Nairobi, the workplaces in Nairobi, the industries, when you go to those factories, there's a lot of congestion and there is no ventilation in those working areas in those factories. We also have a problem with social activities
and interaction
among people living in the city. So sherehe
so that puts us at a greater risk of contracting tuberculosis. Now the statistics now have started to make sense. So I think we go back to the basics. Open your windows, make sure there is proper ventilation wherever you are at. If you have the opportunity or the chance, be in a properly ventilated place. Before we get to this year's theme, what are some of the myths and misconceptions surrounding TB? So
you remember what was happening long time ago, like when we were growing up, people used to think that TB is for that family. It's a genetically, inherited disease. That is a myth, and it is not true. TB can infect anybody. Anyone can get tuberculosis. So it is not for that family. It's not for the other family. Actually, the reason people used to relate tuberculosis with families is because that time, even the healthcare facilities were not very readily available to us. So even getting to that nearest district hospital then was a problem. So one person would get tuberculosis tuberculosis in a family, and everybody in that family would be infected with tuberculosis. And that is the reason why people used to think that it's a familial disease. Yes. So it's also not as a result of some witchcraft or something.
Yes.
You can
it is just a disease like any other respiratory disease, like many others.
Many others. Yes. You cannot get TB by sharing utensils.
Yes.
Because like in our families, at times people tend to isolate people who have TB.
Yes.
Yeah, you cannot get infected with TB from sharing utensils with somebody who has TB.
Yes.
Yeah, but kindly make sure you of course clean your utensils well, like we do for every other preventive measure.
Exactly, as a preventive measure, but not necessarily that if you share a plate of food, you're going to be infecting another person with tuberculosis. Yeah. What is this year's theme for World Tuberculosis Day?
So the theme for this year, World TB Day, is yes, we can end TB. It's very simple.
Yes, we can end TB.
Yes, we can end TB. And the National Commemoration Day is taking place at Uasin Gishu. And we are doing a lot of screening. We are doing a lot of awareness for tuberculosis, so that our communities, our populations will come to our healthcare facilities, consume our services. We are screening for free, diagnosing for free, and treatment is for free. Also across public healthcare facilities, and also some private facilities. Yes.
So you have no reason whatsoever not to be, because the diagnosis and treatment is actually provided for free. And we have quite a number of public hospitals, even before you go to the private sector. And you're hearing they have gone the extra mile of actually providing free treatment, diagnosis and treatment for TB in some private sectors. So what's the plan? If we are to end TB by the year 2035, what are some of the things that we are doing to make sure that we have achieved that dream or goal?
Oh, thank you. Number one, I talked about TB preventive therapy.
Yes.
There's something we call latent tuberculosis. Latent tuberculosis is that bacteria that is just lying in your lungs. Remember, tuberculosis is an airborne disease. The first site of infection is the respiratory system. It doesn't matter where else the TB is. Initially, it must have started from the pulmonary system. So if you have that latent or sleeping bacteria, sleeping in quotes, that latent bacteria in your system, it's usually said that up to 15%, 5 to 15% of the populations who have latent tuberculosis will progress to active disease. These are two different things. There is active disease and there is the latent bacteria. When you are in latent stage, you are not a TB patient. You cannot infect anybody. With your TB. Investigations are normal. Your chest X-ray is normal. You're not a TB patient for us. So if we treat this person who has latent TB, there will be no chance that 5 to 15% of developing active TB disease. So that is one of the strategies that we are making to make sure we end TB by 2035.
And question on that before we go to the next point. If this bacteria is latent, how will you know that a person has this latent bacteria for TB?
Number one, there are populations that we want to screen for latent TB. And number one population is those contacts of people who have tuberculosis, because you get this latent bacteria from a person who has tuberculosis. TB, but because of your immunity, you have not progressed to the active bacteria. I mean, the active phase of tuberculosis. So, like I said, we want to screen the contacts of the pulmonary TB patients. The reason we are screening them we are screening them so that we get to know, number one, if they already have active TB disease. If they have active TB disease, we will treat them. The other reason we are screening them, we want to see if they are in latency. Are they having a latent phase of tuberculosis? If yes, we give them TB preventive therapy so that we kill that latent bacteria before it gets to active disease.
Amazing. That is a good goal. That is a good way of progressing to getting to the year 2035 TB free. And I think that is great. So this one, you have said this year's observance is going to be going down at Uasin Gishu. So do you move across counties?
Yes. Actually, even this is the national activity now, which is in Uasin Gishu, but counties are doing different activities. Like for us in Nairobi County, we'll be hosting our 1 TB Day commemoration activities at bus station.
At bus station,
Nairobi,
in town.
Yeah, in town. And we are targeting the matatu crew. We are targeting the matatu industry because that is where we're having a lot of tuberculosis. There are a lot of people also in the matatu industry who have devoted care because of the setting of their work. You know, so most of them forget even taking medication or even just assume that they're now okay. After, you know, for TB, if you take medications for actually from 3 weeks, your body responds very well. And even you feel better, you're up and about, you back to work again. So even some people think that they're okay. But that is not true. You have to take the medication up to 6 months for you to be declared cured of tuberculosis. So we are doing our activity at bus station. Actually, we started activities from today where we are screening a lot of people. Actually, not just a matatu crew. We are screening anybody that passes around a bus station. We have a machine there, a chest X-ray machine on site. We have a Gene Expert machine. Gene Expert machine is one of the most new tools that we are using to diagnose tuberculosis, highly sensitive and highly specific for tuberculosis bacteria. So yes, we are doing our activity here in Nairobi, and I believe all other counties are doing something, and the key activity that we are doing this time is screening and treating the ones that we are diagnosed with tuberculosis.
Amazing. I think this brings us to the end of the conversation. But if someone wants to follow up the conversation on tuberculosis, are you guys online? Is there somewhere someone can go and actually get information on tuberculosis?
Yes, you can visit our healthcare facilities everywhere across the country. And nowadays, we are offering TB services from level 2 facilities. Level 2 facilities are dispensaries. Level 3 facilities are health centers, the ones that have maternities. Level 4 and even up to level 6. So you can visit the healthcare facilities, and you can actually even go directly to the TB clinic. Even the ones that want to just get screened. You don't have to make those queues. We have people who are doing fast tracking in the facilities, where if you have a cough, you can be given a priority for you to see a clinician in that facility. And we also you can also visit the sites, the National TB Program site. There's a Facebook account where you can go and get to know whatever you would wish to know about tuberculosis.
As much information as possible. When we were beginning, you said you are the representative for Nairobi County for both tuberculosis and leprosy. Are we still dealing with leprosy?
Yes, I coordinate TB services in the sub-county. But I'm working for Nairobi County government. Yes, leprosy is there. It exists. And we have new cases, actually. Not even the existing cases alone. We have new cases even here in Nairobi and across all other counties in this country.
Wow, what is causing, well, just briefly, what causes leprosy?
Leprosy is in the same category. Is actually the bacteria is in the same family as the one that causes tuberculosis. Yes, because for tuberculosis it is Mycobacterium tuberculosis, but for leprosy it is Mycobacterium leprae. So it is in the same family with the bacteria that causes tuberculosis. So it is key for you to probably we can get another day and talk about leprosy, because it's a whole session.
Exactly. That's what I'm thinking. I think we will get another time to talk about leprosy. That is very intriguing information. How we'll be able to sit here and keep it KUTV Kenya. We are going to call Penina back to actually talk after we are done with observing of the tuberculosis day. We can be able to talk about leprosy some other time. Any final words you'd like to tell our audience? Tell them where they can get all these where they can get the information on tuberculosis as we close.
Thank you so much, Karen. So this is the World TB month, actually. And we want to do a lot of screening for tuberculosis. Like I said, if you have a cough of any duration, and that is the common symptom for tuberculosis. So if you have any cough, you have a night sweat, fever, weight loss, kindly make sure you visit our healthcare facilities. For the ones that can seek care in private facilities, kindly do. But we are offering free services at all public healthcare facilities across the country. It will be, or you will not be charged anything while seeking TB services in our facilities.
Yes.
So kindly make sure you screen yourself. There is no more stigma like it used to be.
Yeah.
So kindly come to our facilities, consume our services, and we'll be there to assist you.
Exactly.
Yes.
Thank you. Thank you very much, Penina, for being here. Thank you for all that information. We have truly, truly appreciated. Yes. And I hope that will help us to observe the World TB Day better, and even Tuberculosis Month right here, so that we can be able to stay aware. Please go if you have any of those symptoms. I think that is the most important part. Go for screening. Yes. All right? Yes. And then follow up with treatment if you actually have contracted TB. Yes. Thank you so much for joining us and for keeping it locked. I hope that you have learned a thing or two. We are going back to Women in Film Awards, the award ceremony, because we are still celebrating women that are doing great things in the film industry.